India continues to struggle with record daily surges in COVID-19 infections. Nearly 29,000 new cases have been reported in the past 24 hours. 500 new deaths have also been recorded. The spike has prompted more cities and states to reimpose shutdowns. Bengaluru city will return to a total lockdown tomorrow, likely to last at least a week. The most populous state of Uttar Pradesh has decided to implement complete lockdowns every weekend until the end of the month. Several places, like Assam state, have announced lockdowns in high-risk areas. Others, including the hardest-hit Maharashtra state, have already extended restrictions. Total infections across the country now stand at more than 800,000. Observers warn that at the current rate, it may pass 1 million this week. Now, for more on this, Neha Punia joins us live. Neha, for the past weeks, every day has seen a new high. Why isn't the federal or local governments doing more to stem the rise of infections?
Steve, that's been one of the biggest criticisms of the government's handling of this crisis, both at the central as well as regional levels, because even back in March, when India only had 500 cases, the government imposed a strict nationwide lockdown that was in place for nearly 2 months. And experts had said that repeatedly, that lockdowns are not effective by themselves. You need to couple that with increased testing, with ramping up of healthcare infrastructure and increasing your capability to contact trace and isolate and treat patients. India is doing all of that, but nearly 3 months into this pandemic, reaching the levels it has currently. And most experts are saying that the other challenge, of course, is that the government is simply refusing to admit that there's any kind of community transmission of COVID-19. This means the disease is spreading unchecked from person to person, which would, experts say, make sense given that lockdown restrictions have been almost entirely diluted in large parts of the country. People are stepping out more. They're going to malls, restaurants, and places of worship. And experts say that this interaction, this stepping out in public places, often without masks, is what is adding to India's increased tally. But the government maintains that its strategy has worked well. It continues to cite the fact that India has a low caseload when you look at per million data of the population. Similarly, saying that India has 40 times less deaths per million when you compare it to other worst-hit countries. But experts are saying until you change the policy approach to how you're dealing with this pandemic, instead of simply focusing on containment zones, these are areas with active COVID-19 cases, these numbers will continue to happen, and India's COVID-19 tally will continue to grow at this alarming rate for the coming few months.
Neha, speaking of this policy approach, cases there continue to surge. We know that despite the states reimposing lockdowns, are there any issues with people adhering to the restrictions?
There are. In fact, Prime Minister Modi held a meeting this weekend where he urged both union as well as regional government employees and officers to ensure that the focus now is on creating social awareness. He said the biggest challenge is that because the government has diluted lockdown restrictions, people seem to think that the fight against COVID-19 has been won. He said this previously about 2 weeks ago as well, saying that this is when we need to be the most vigilant and not let our guard down. But this is a massive problem. People are wearing masks more or less, but they're not wearing them properly. Many times they have them around just their mouths or perhaps just covering their nose. Social distancing is a huge problem in a densely populated country like India. So all of these issues are what experts say need to be equally immediately addressed by the government, and something the government says it's working to do.
All right, thanks for that, Neha Punia, speaking to us from New Delhi.